Here are some new keywords learned throughout this presentation, starting with granuloma. A granuloma is a structured aggregation of immune cells, primarily macrophages, epithelioid cells, and lymphocytes that form in response to a persistent inflammatory stimulus, such as Mycobacterium tuberculosis. In TB, granulomas are critical because they represent the body's attempt to contain the bacteria, preventing widespread dissemination. However, the center of these granulomas often undergoes caseous necrosis, which can serve as a niche for latent infection, making granuloma formation a double-edged sword in the disease's pathogenesis. The second one is casus necrosis. This term refers to a form of cell death in which the tissue maintains a cheese-like appearance. In tuberculosis, casus necrosis occurs at the center of granulomas and is indicative of tissue destruction caused by the immune response to the mycobacteria. Its presence is significant in TB diagnosis because it is a hallmark of the disease seen on imaging studies and histopathological examination, helping to differentiate TB from other pulmonary infections. Number 3, latent TB infection. Latent TB infection refers to the state in which Mycobacterium tuberculosis remains in the body in a dormant state without causing active disease symptoms. Despite the absence of clinical manifestations, latent TB is important in public health and clinical practice because individuals with LTBI serve as a reservoir for potential reactivation, especially when their immune system is compromised. Recognizing and treating latent TB is a crucial strategy in preventing active disease and curbing the spread of tuberculosis. Fourth one, acid-fast bacilli. This term describes bacteria that resist color or decolorization by acid alcohol after being stained with dyes such as Ziehl-Neelsen. Mycobacterium tuberculosis is characterized as an acid-fast bacillus due to its lipid-rich cell wall. The acid-fast property is essential for diagnostic testing, and AFB smear is a standard test in TB diagnosis, as it allows clinicians to rapidly identify the presence of TB bacilli in sputum samples, contributing to early treatment initiation. Next is multi-drug resistant tuberculosis. MDR-TB is defined as tuberculosis that is resistant to at least isoniazid and rifampin, the two most powerful first-line TB drugs. The emergence of MDR-TB is a major public health concern because it complicates treatment, requires longer and more complex drug regimens, and is associated with higher morbidity and mortality rates. Understanding MDR-TB is critical for TB management as it drives the development of new therapeutic strategies and reinforces the need for strict adherence to treatment protocols to prevent resistance from developing.